Miigwech. I had referenced earlier on that we were going to talk about a little bit about the Zoom meeting and protocol and procedures. So I'm going to start that now. So if anyone participating on Zoom, and I know some are on the phone, but anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. We can get feedback and distortion if you don't. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and please do not put the phone on hold, because then we get this really awful hold music in the background. Finally, please avoid using speakerphone when speaking, and speak directly to your device's microphone or your telephone receiver. I'm going to ask the board secretary to conduct the roll call.
Thank you, Chair. Member Banham? Member Cloutier?
Present.
Vice Chair Di
Present.
Chair Eglai? Member El Shantari?
Present.
Member Gower?
Present.
Member Kavanagh? I believe she had to sign out and will be signing back in. Member Lakin?
Present.
Member Menard?
Present.
Member Pinel?
Present.
And Member Tilley?
Present.
You have quorum, Mr. Chair.
Okay, and I see that Councillor or Member Kavanagh is signed back in as well.
Yeah,
Thank you.
I was frozen out and had to start again.
Yeah, no problem. Happy to have you here.
Mr. Chair, I might be off the camera as well because we get those messages. It's a low bandwidth here, so but I'm still joining the meeting, but no camera for now.
Okay, fine.
Thank you.
Better that we can hear you. So some further procedures for the Zoom meeting. So the following procedural guidelines are being implemented to promote orderly proceedings of the virtual meeting. First of all, on attendance, should members need to leave the meeting, they should advise verbally that they are doing so before clicking on leaving the meeting from the Zoom platform or ending their call if they're participating by phone. This will help us keep track of quorum. Speaking order, so I'll provide each member with the opportunity to ask questions or comment. Members will be called on to speak in the order set out in the board secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on any given matter, you may decline verbally when your name is called. In terms of voting, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Any points of order, privilege, or challenge should be handled in the following way. Procedural interjections should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before starting your point of order. If we have to recess, for example, should technical difficulties or other unforeseen matters require a recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. So we'll carry on into the regular meeting now, unless there's any questions about process using the Zoom features or on the phone. Okay, seeing none. Are there any declarations of pecuniary interest? Okay, seeing none, we'll move on to the confirmation of minutes of the meeting of April the 20th, 2020. Carried? Any dissents? Okay, thank you. We received 5 communication items and they are as noted in the agenda. I'm going to call upon Member Pinel to move the motion to introduce reports, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health 2019 Annual Report, Reconciliation, Indigenous health equity and COVID-19, Ottawa Public Health Strategic Plan for 2019-2022, update from Q1 of 2020, 2020 Operating Budget Q1 Status Report, Board of Health for the City of Ottawa Health Unit be received and considered.
Carried. Any dissents? Okay, thank you very much. We'll now go through our usual consent agenda process. For those participating or watching from home who may not be familiar with this process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns and we don't have any public delegations registered to speak, the board may carry or receive those items on consent, which is to say, without any discussion. So first is my verbal report, so we'll hold that. Secondly is Dr. Etch's verbal report with an accompanying motion, so we'll hold that as well. Their third item is the Ottawa Public Health 2019 Annual Report. Can we carry that on consent? Carried. Any dissents? Okay, thank you.
Carried.
Number 4 is the Reconciliation, Indigenous Health Equity and COVID-19 report. Can we receive this?
Received.
Okay, thank you. Number 5, Ottawa Public Health Strategic Plan for 2019-2022, update from Q1 of 2020. Received?
Received.
Thank you. No dissents? Okay. Number 6 on our agenda is the 2020 operating budget Q1 status report, Board of Health for the City of Ottawa Health Unit, and there is an accompanying motion with regard to funding. We can receive the report and carry the motion if there are no questions. However, if anybody wants to hold it for questions, that's fine too.
Chair Member Cloutier here. I have 3 pretty short questions. We could hold it, or I could deal with them now.
Well, let's hold it. If you have 3 questions, that may lead to other questions from other members, so we'll hold that as well. No problem at all. And I will just note that. So I'm going to provide my verbal report now. I'd like to start off by, first of all, thanking everyone who rode transit today and wore a mask. The reports I'm getting in is there has been very positive uptake for that initiative launched by OC and supported by the Board of Health. So I want to thank everybody who's done that. And for those who haven't ridden transit today or are thinking about whether they're going to wear a mask or not, I'd like you to consider doing that in your future trips. So for this evening, I'd like to highlight some recent accomplishments that the Board of Health or the Health Unit has achieved, and also provide an update on a motion approved by City Council at its meeting of May 27th, and its implications for Ottawa Public Health, and update members on the city's response to COVID-19. As noted earlier, we invited Grand Chief Polson to join us this evening. We did so in order that she may receive a new health protection resource on behalf of the Algonquin Anishinaabe Nation, whose land and people were top of mind as this resource was being developed. Grandpa's Wisdom, an Algonquin reflection on West Nile virus and Lyme disease, is an intergenerational story authored and illustrated by Elder Albert Dumas, who also joins us this evening. He is, among other things, an Algonquin poet, storyteller, artist, traditional teacher, and spiritual advisor. This book is a result of a year-long collaboration between Ottawa Public Health and Elder Dumas. As a team effort, I would also like to acknowledge Joan Tanasco, for the Algonquin translation, Anishinaabe printing for the graphic layout, and OPH staff, including Mike Ferguson, Mackenzie Allen, Michelle Goulet, and Stanton Lukes, Dr. Munir Taha, and Kim Trotter, as well as Aaron Corsten, the former Indigenous engagement specialist at Wabano, and the Champlain Lynn, who enthusiastically brought the team together. This project has had many positive impacts that speak to the principles of reconciliation, including developing a respectful awareness and understanding of Algonquin history, culture, and language, building and strengthening relationships, sharing and merging Indigenous and Western knowledge, and continuously reflecting on and learning from the process and partnership on this journey together. In an effort to help restore the Algonquin language, Elder Dumas' story is written in Algonquin, English, and French. Although COVID-19 has slowed the process, it is our intention to share printed copies when available with the Algonquin Anishinaabe Nation Tribal Council for distribution within their communities. Similarly, this innovative resource will be offered to local schools and library in Ottawa as a means to promote Algonquin knowledge and health protection related to Lyme disease and West Nile virus. Chi miigwech, to everyone involved, thank you in this project and for all of the support and guidance that Elder Dumas provided. Albert, you have truly inspired those who have had the privilege to work with you, as we heard earlier today through the comments of Grand Chief Polson. Before I go any further, Albert, I'd like to invite you to say a few words. Albert, are you still with us?
Yeah, yes. Hello.
Hi. We were just wondering if you could say a few words about your book and the project.
Yeah, I will do that.
Thank you very much.
Okay, miigwech. Yes, I'm often called upon to help out with spiritual concerns and human rights activism. And I'm speaking to you now, though, as a storyteller. I know that from the First Nations traditions, we lean on and depend on stories that are often ancient stories, that their origins are so far back we really don't know where they began, but they all have important life lessons, you know, that help human beings to become better human beings, to understand purpose of life as opposed to waste of life, you know, the difference between common sense and nonsense. So whenever I was asked by the city of Ottawa to write a story about West Nile and Lyme disease, I was so honored, you know, I truly accepted it as an act of reconciliation. I was pleased to help out, and as I moved along with the project, I was making contact often with Mike Ferguson, and he was keeping me posted as to what the team was recommending, and I followed those recommendations, and together we produced this story. And I hope, well, I know it's going to have impact in a good way with all the communities, Indigenous and French and English peoples residing in Algonquin territory. I'm honored, and I'm so pleased, and I'm grateful to Ottawa and to its leadership and to the citizens of this great city. And I look forward to helping out in the future with further promotion of this story. So miigwech to everybody.
Thank you very much, Albert. And I look forward to when we're in a position when we'll be able to share the copies of the book with the various communities. I'm wondering, Grand Chief Polson, if you would share a few words with us again in relation to this project and the work that Albert has done.
Hi again. Thank you, Chair. Absolutely. Yes, I want to acknowledge Elder Albert. Excuse me there. Elder Albert, for the book. I've read the copy that was sent to me. You know, it gets you thinking of what our ancestors and what our grandparents has been telling us throughout our years growing up with them, and when they took us into the forests and onto the rivers when we traveled when I was younger as well. You know, that we need to work together, no matter who we are, the color of our skin, or where we come from. We're all put on this earth to be humble with one another. And you know, the book, when I read the book, you know, it really touched me, and because my grandmother as well, she had spoken to me about the viruses that hit her family while they were living in the bush as well. So you know, there's so much knowledge that our people have um, to share with everyone, especially on our traditional territory, Ottawa, Gatineau, and Val-d'Or and surrounding areas. So you know, I was so happy and honored when Albert told me about his book, and I was pretty anxious to read it. And I know Albert, he works hard. He worked hard to where he is and what he's doing today. And that's why I said earlier that when I need guidance or support, I try to reach Albert and talk with him where he can give me a better sense of, you know, of what my struggles are my good times that I'm having as well, not only the struggles. And this is who we are as Anishinaabe people of this land. Um, we love to share and we love to care for one another, not only for our families, but everyone else who is in our circle. May it be a friend or our family. So I just want to really thank Albert for the tremendous, great work that he's been doing throughout his life. And I can't wait to see the next book of Albert's. I read a couple of his books. He's very talented. So I thank you, Albert, so much from the bottom of my heart for the great work that you've been doing throughout your lifetime. And I thank this board as well to give you this opportunity to share a story that was close to your heart when it comes to your grandfather and yeah, Chumas. So you know, we've come a long ways. So I thank you again. I can't say how much I'm grateful for all of you for giving us this opportunity to even be here and talking and sharing our wisdom and sharing our, you know, our beliefs with each and every one of you. Because at the end of the day, we all want to be treated the same way. So this is how it starts from different nations, Métis Nation, Inuit Nation, First Nations across Canada. We just want to be part of the process when there's decisions taking place, because it also affects us who lives in the Ottawa area. So miigwech, and thank you, Chair, and thank you everyone on this council. Keep up the great work. And I hope that I get another opportunity to sit in and just to listen on the great work that you do on a daily basis for Ottawa and the people surrounding, especially First Nations and the Algonquin Nation. So miigwech.
Was presented with the Leadership Award in Nursing Administration. This award recognizes exemplary nursing management by a registered nurse or nurse practitioner who acts as a change agent, resource, and mentor within a professional setting. It is bestowed upon individuals who actively collaborate with healthcare teams to enhance patient care through the development and implementation of innovative and creative strategies. On behalf of the Board of Health and the entire OPH team, I'd like to congratulate Esther on this wonderful and well-deserved recognition. My only regret is I'm not there to shake your hand and in person, but well done, Esther. Very impressive, and we just want to all thank you for that good piece of work and recognition. Moving on to the council update, like many North American cities, Ottawa is experiencing a toxic drug supply, prompting local healthcare providers to consider adding safer supply alternatives for their patients. In September 2019, the Canadian Medical Association Journal released a national guideline recommending that injectable opioid agonist treatment, or IOAT, be considered for individuals who have not benefited from oral treatment like methadone or Suboxone and continue to use opioids by injection. Building on the success of these interventions, safer supply initiatives seek to offer a lower barrier service model, providing accessibility and flexibility for clients, including less restrictive eligibility requirements and additional medication options, which enables reach to a broader population of people who use drugs. As the local health unit and the core harm reduction program for Ottawa, Ottawa Public Health fully supports safer supply initiatives, as was noted in a report to the Board of Health last fall. I'm happy to report that on May the 27th, City Council unanimously approved a motion calling on upper levels of government to assist in implementing and funding the expansion of safe supply in Ottawa in order to provide immediate supports to people who use drugs and to decrease burdens on communities experiencing the impacts of addiction. Pursuant to that motion, the Mayor has written to both the federal government and provincial governments, specifically to the Prime Minister Trudeau and the Federal Minister of Health, Patty Hajdu, as well as to Premier Ford and the Provincial Minister of Health, Christine Elliott, asking for their support on moving forward with these life-saving programs. We eagerly await their responses and look forward to being able to move ahead with such initiatives in collaboration with community partners. Last Wednesday, the city manager presented the city's reopening plan to City Council. This was an important milestone in the city's ongoing response to COVID-19. The situation remains fluid and the city continues to be in a state of emergency in order to be able to react quickly to a changing environment, access critical resources, and to respond to evolving community needs. The city also continues to closely follow the advice of Ottawa Public Health and to take its cues from the province of Ontario in terms of our reopening plans. With this in mind, some of the city's programs and services are cautiously starting to reopen in a gradual phased approach from now until the end of August. The reopening plan prioritizes programs and services that promote a safe and strategic expansion of Ottawa's economy with ongoing support for our most vulnerable communities. Above all, the city is prioritizing the health and safety of its staff and of the community in general. Accordingly, the plan focuses on three key areas: safety, services, and people. In terms of safety, the city will be providing personal protective equipment to some staff on a priority basis, and otherwise promoting the use of cloth masks in situations where that is warranted, such as I mentioned earlier on public transit. They are installing engineered sneeze guards at 55 public-facing service counters, as well as physical distancing signs, floor decals, and directional markings in city facilities. Site-specific cleaning and disinfecting protocols are being implemented at each facility, as are client screening protocols based on risk assessment in specific service areas. City services will gradually resume based on a phased approach. The reopening plan prioritizes public transit, recreation, and childcare services to support residents returning to work and to provide relief during the warm summer months. The city will also continue to support our most vulnerable populations and help restart Ottawa's economic recovery by supporting local businesses. Many city facilities may look different, and some programs and services will be delivered in a new or modified ways to help keep everyone safe. This includes more virtual and online services, reduced group sizes for programming, appointment-based in-person counter services, and contactless document drop-off. In addition to the safety measures listed above, the city is taking steps to protect and preserve its workforce. Employees who are currently working from home will continue to do so for the short term while the city assesses its facilities to determine what redesigns or retrofits may be needed to workstations and floor plans to ensure that employees can safely return to these spaces. A formal work from home program is being developed to ensure those working remotely have all the resources and supports required to continue to do so. A comprehensive health and safety policy is being finalized that will include self-screening requirements, personal protective equipment, and other preventative measures for employees. Employee training is being developed with respect to new safety protocols and standards related to COVID-19. And a number of other health and wellness resources are being augmented to support employees. Reopening services takes a significant amount of coordination, planning, and execution. And overcoming these new and unique challenges will require patience, flexibility, and the combined efforts of staff, residents, and community partners. More detailed information about the city's phased reopening of its various programs and services can be found under the city news banner on ottawa.ca. So as mentioned earlier, I will call on each member by name to invite questions or comments on my verbal report. Member Banham. Member Kuche. Vice Chair Giovanni.
No questions, thank you.
Member El Shantiri.
No, thank you, Mr. Chair.
Member Gower.
No questions, thank you.
Member Kavanaugh.
I'm fine, thank you.
Member Lakin.
Thank you for your report, Chair. No questions.
Member Menard.
No questions, thank you.
Member Pinnell.
Yep.
Thank
No
you.
question, thanks.
Thank you. Member Tilley.
All good, thank you.
You guys make this way too easy. Can we receive the report then?
Received.
Thank you. Just a question to the board secretary. On my notes, it indicates the verbal report is amended by a motion, but we did not have a motion, correct?
That's correct, Chair. That was an error in the
Okay,
notes.
no, just
Sorry.
making sure we're not in the same room, so we don't have the same channels of communication. I just want to make sure that I didn't make a mistake.
It was my mistake, Chair. I
As I
apologize.
usually do at some point in the meeting. So thank you for that clarification. I'm now going to ask Dr. Etches to provide her verbal report, and then again, we'll go through the same approach to get to questions, if any, and to receive it. So Dr. Etches, over to you.
Sure. Good evening, Kwe, Enge, bonsoir. I also want to begin by acknowledging and honoring the Algonquin Anishinaabe people on whose unceded territory the city of Ottawa is located, and we're having our virtual gathering. This is a place that's been a gathering space for many peoples for a long time. And I want to thank the elders. Thank you for your prayers and your words of wisdom and opening today's meeting and helping us mark this special month and continue our work on reconciliation. I especially want to thank you for adapting to our electronic circumstances. So this week contains the summer solstice and National Indigenous Day this coming Sunday, June 21st. It's a time to celebrate Indigenous resilience and strength and culture. And really that resilience is evident given that they're holding celebrations, the community virtually this year. So we also want to recognize that Indigenous people still experience discrimination, which was highlighted in today's report. I don't think we'll talk about it in detail, but it was highlighted in our report on reconciliation, Indigenous health equity, and COVID-19. And we are committed as Ottawa Public Health to continuous improvement in the public health actions that promote reconciliation and the health and well-being of First Nations, Inuit, and Métis peoples and communities. So I wanted then, in this verbal update, bear with me, it's a little bit longer because I want to go beyond COVID-19 again, although I'll come back to COVID-19. I'm going to talk about some vector-borne illnesses, our work to review, reconsider, and resume some of our programs and operations as we move into stage 2, some of the unintended impacts of the pandemic, and then more on the pandemic. So beginning with vector-borne illnesses, much of our recent focus has been on COVID-19 and our efforts to flatten the curve, and now to maintain the flatness of the curve. However, as the season progresses, we need to keep in mind these other infections that pose risks to our health, those spread by black-legged ticks and mosquitoes. So just as people in Ottawa are taking measures to protect themselves from COVID-19, our efforts to make tick checks and avoiding mosquito bites part of our daily routines will avoid unwanted infections. So it's worth noting that, like with all other respiratory illnesses, there's no evidence to suggest that COVID-19 is spread by mosquitoes or ticks. The main way that COVID-19 spreads is person to person through respiratory droplets or direct contact. And while most mosquitoes are just a nuisance, some can pose a health risk as carriers of West Nile virus. So residents can protect themselves and prevent bites by using an insect repellent containing DEET or icaridin, wearing tightly woven but loose-fitting light-colored clothing, long pants and long sleeves, and keeping screens in good repair. Alors que la plupart des moustiques ne sont que nuisances, certaines peuvent poser un risque à la santé en tant que porteurs du virus du Nil occidental. Les gens peuvent se protéger et prévenir les pics en utilisant un insectifuge contenant du DEET ou de icaridin, en portant des vêtements clairs, tissus serrés mais amples, des pantalons longs et des manches longues, et en gardant les moustiques moustiquaires en bon état. Because these mosquitoes like to live in proximity to human habitat and they breed in standing water, it's important to eliminate pools of water and locations around the home, such as in old cans or jars or tires or plastic toys, flower pot saucers, and so on. And if you have a bird bath, to change that water every 7 days. If you live adjacent to outdoor areas that are suitable for ticks, such as wood lots or areas with tall grasses, or if you visit these areas while on walks or hikes, you also need to be aware of the risk of Lyme disease. Si vous vivez à proximité de zones propices aux tiques, telles que des bois ou des zones à herbe haute, ou si vous visitez ces zones lors de promenades ou de randonnées, vous devez également être conscient du risque de la maladie de Lyme. The black-legged tick that is known to carry the bacterium causing Lyme disease is present in Ottawa, across Eastern Ontario, and the Outaouais region in Quebec. So Ottawa Public Health is monitoring this, and we're providing information to residents and physicians to help prevent and reduce Lyme disease in our community. We have seen an increase in the number of Lyme disease cases reported in the Ottawa area over time, as well as an increase in the Lyme disease likely acquired in the Ottawa area. So residents are asked to do their best to stay on cleared paths, but if your trek brings you into tall grasses or forests, tuck your pants into your socks, those long pants that you're wearing because of mosquitoes. Apply insect repellent to discourage ticks from crawling up the outside of your pants. And importantly, perform that full body check on yourself, your children, your pets at the end of any excursion. Pay careful attention around the knees, the toes, the groin, armpits, and scalp. And if you do find a tick on your skin, carefully remove it following instructions available on our website, ottawapublichealth.ca/Lyme or /Lyme. I apologize, I seem to get the slashes and the backslashes mixed up. Sorry, team. Residents should immediately contact their family physician if they experience flu-like symptoms following a mosquito or a tick bite. If you have a bullseye type rash or other type of rash after a tick bite, or if a tick has been attached for more than 24 hours. If it looks partially or fully engorged, or if unsure of the length of time the tick has been attached. So fortunately, Lyme disease is treatable with antibiotics, unlike West Nile virus or COVID-19. However, prevention is the best approach with these, as with all infectious diseases. So for more information, please visit our website. Now, on reviewing, reconsidering, or resuming our regular operations, much like the rest of the City of Ottawa, Ottawa Public Health is also looking at resuming some of the programs, services, and initiatives that were put on hold or scaled back when we shifted our focus to the pandemic response. We're also looking and taking the opportunity to review what may benefit from a different approach and to reconsider priorities as the COVID-19 response continues. Tout comme le reste de la ville d'Ottawa, Santé publique Ottawa envisage également de reprendre certains des programmes, services et initiatives qui ont été mis en suspens ou réduits lorsque nous avons réorienté notre attention vers la réponse à la pandémie. Nous profitons également de l'occasion pour examiner ce qui pourrait bénéficier d'une approche différente et pour reconsidérer les priorités à mesure que se poursuit la réponse de la COVID-19. So to support the ramp up of OPH services, a new temporary core services branch has been established in Ottawa Public Health. It's led by Esther Mogadam and supported by Dr. Robin Taylor as an Associate Medical Officer of Health. Andrew Hendricks will continue as the incident commander leading the COVID-19 ongoing response. So in a sense, there are two interconnected OPH organizations operating. In our response to COVID-19, our core critical services continued. However, much of our regular service delivery was interrupted and had to decrease or stop altogether. So I want to mention someone whose name has already been raised this evening, Mike Ferguson, who led collaboration with Elder Dumont, but to thank him for his contribution as the Acting Director of Health Protection over the past few months. He's really been an exceptional leader, supporting teams to carry on with core critical services and adapt under extraordinary circumstances. Thank you, Mike. We currently have a window of opportunity to rebuild capacity and deliver much needed services to our community. So under the new temporary core services branch, we will fully or partially restore or renew services under a continuity of operations plan. So including healthy growth and development, dental health services, sexual health services, harm reduction, sexually transmitted bloodborne infection related programming, mental health, immunization, safe food and water, health hazard responses, communicable disease and enteric and zoonotic infections, as well as work with the city's planning and development. Now, the fifth goal, another report that was carried that we won't have time probably to delve into too much, but under our strategy, the report on our quarterly update on our strategy, the fifth goal was to continuously improve our core work to maximize impact. It is rated as off track this quarter because not all teams were able to report on Q1 data because of COVID-19. However, this work that Esther's leading with the team will be along the lines of advancing this goal because we're reviewing our work and always looking at how we can have the most impact given limited resources and new circumstances. Moving on then to some of the unintended impacts of the public health interventions to address the COVID-19 pandemic. COVID-19's led to the death of 258 Ottawa residents. And without public health interventions, this tragedy would have been much worse. And we know that the response to the pandemic has generated unintended consequences, whether due to the isolation people have felt as a result of physical distancing measures, or due to stress and anxiety over their unemployment or financial situation, or a combination of factors, including increased substance use. Nous savons que la réponse à la pandémie a eu des conséquences imprévues pour plusieurs, que ce soit en raison de l'isolement que les personnes ont ressenti à la suite des mesures de distanciation physique ou en raison du stress et de l'anxiété liés à leur emploi ou à leur situation financière, ou encore d'une combinaison de facteurs, y compris une consommation accrue de substances. Ottawa Public Health is very sensitive to these issues, and we've been working hard to provide resources and coordinate supports wherever possible, such as with the Human Needs Task Force of the City of Ottawa. And from the onset of the COVID-19 response, Ottawa Public Health team members have continued to work with school boards, hospitals, mental health and substance use partners, community partners, multicultural and racialized community partners, and the general community in the area of mental health promotion, suicide prevention, and reduction of harms from substance use. There's key focuses. It's key focus, but it's quite a few things that this mental health and substance use work has included. I will just list them. We've been doing mental health surveillance, data collection, and also supporting research. We have been doing mental health and COVID resources development and programming, including web page development, a mental health education series entitled Protecting Your Mental Health. And this is in partnership with the Royal Ottawa and many others, supporting the coordination and outreach of mental health and substance use crisis, counseling, and treatment services. We've been developing substance use resources in partnership with the Canadian Centre on Substance Use and Addiction and others, such as an alcohol harm reduction video and education resources and coping strategy tools. We've been supporting local school boards with resource development for teachers, students, and their parents. And we've been developing a toolkit and guide for City of Ottawa organizers and employers titled Managing Through COVID-19, an Employer Mental Health Guide, and working with partners to contribute to a strategy to protect those experiencing violence and neglect at home. And lastly, working with partners in the community to develop a mental health strategy for outreach to diverse communities, including the launch of webcasts with Councillor King, development of multilingual resources, and continued work on the African Caribbean Black mental health research study. As restrictions are lifted and people are able to resume activities, some sources of stress may improve. With the provincial announcements and expanding social circles, people will have more opportunity to connect with others and access the supports they need. However, experience from previous major impacts on the economy suggests that the risk to health will be ongoing, and Ottawa Public Health will continue to investigate impacts on health and work with partners to mitigate harm. So more on OPH's response to COVID-19. Board members, you've been receiving regular updates and you're aware of much of the work, so I'll just focus on a few new developments. The province has announced that an exposure notification app will be launched in July, and as well as an improved information system for centralized case and contact management, among other provincial improvements. So I think at our last formal meeting, we had talked about advancing an app ourselves, and we have put that on hold, or and we're waiting. We're going to anticipate the province will come forward with a solution that will be useful. So the digital solutions team has been contributing to the provincial plans based on our own experience with our local case management and contact management solution. And Kevin Neal and I were able to meet with Dr. Jane Philpott last week, as leading a data strategy for the province. We highlighted the directions that would help modernize public health practice. And while implementation of an electronic public health record, which is goal 3 of Ottawa Public Health Strategy, is delayed, we conveyed readiness to proceed and to support province-wide solutions. So last week, Ottawa Public Health launched a new COVID-19 dashboard on ottawapublichealth.ca. I encourage you to take a look. This is a new, more dynamic platform that provides up-to-date information on COVID-19 cases, outbreaks, and core indicators to assess the situation in Ottawa. It also provides a snapshot of information that was previously housed in more than one place, all in one spot. So to facilitate access to data and promote transparency, Ottawa Public Health has streamlined this information into one interactive daily report and a weekly supplement. So looking at the latest data, the trends are positive across all the dimensions on our dashboard. Although we are still finding cases with no known exposure, that means of the new cases in the community, we can't always trace them back to an outbreak or travel or a link to a known case. Les tendances sont positives dans toutes les dimensions de notre tableau de bord, bien que nous trouvions encore des cas qui n'ont pas d'exposition connue. So part of our new case and contact management and our tracing practices has also included gathering data about people infected by COVID-19 along the lines of race and income, so that we can better understand the who's being impacted the most. Nous recueillons de nouvelles données sur les personnes infectées par la COVID-19 afin de comprendre comment la race et le revenu influent sur le risque d'infection par la COVID-19. So we're working with groups such as the Ottawa Local Immigration Partnership and with our healthcare partners to not only collect race data in order to better understand barriers to health or healthcare in Ottawa and health outcomes for people who are racialized, but also to ensure that it's analyzed and interpreted and used properly. And with respect to race-based data, we're just starting to look at it, and we're bear in mind at this point we've only data from May 9th onwards, so we don't have enough to make definitive statements yet. But as we analyze the data, we are seeking community input to understand the information and contextualize the implications. Au fur et à mesure que nous analysons les données, nous chercherons à obtenir l'avis de la communauté sur la compréhension des informations et la contextualisation des implications. So still on the subject of data, it is important to understand that there is still a risk of increase in the level of COVID-19 in our community beyond what our hospital capacity can handle. Hospitals have improved their capacity, but there are ongoing supply issues for personal protective equipment that require careful management, and we each need to continue to do our part to prevent transmission of the virus. Il existe toujours un risque d'augmentation du niveau des infections COVID-19 au-delà de la capacité de nos hôpitaux à les gérer. Nous devons continuer à faire notre part pour prévenir la transmission du virus. With a very small percent of the population likely infected to date, we are very, very far from the 60 to 70% herd immunity that would slow the virus down without physical distancing, mask wearing, hand washing, and efforts to limit our close contacts that are in place right now. Ottawa Public Health's work to follow up with every case and contact is also helping to break transmission, but that occurs after the fact, after the delay in getting tested. And many vaccines are in development, but whether one will be effective remains unknown. And the timeline required to make the vaccine available to the population around the world means we will still not have a vaccine for the fall, when we are concerned about COVID-19 activity on top of influenza virus circulating. So prevention is still required. Our objective and our goal, everyone's goal in the population can be to keep COVID-19 at a manageable level in our community as we return to more economic activity. And when it comes to the COVID-19 testing approach in Ottawa and across Ontario, Ottawa Public Health is continuing to work with the Champlain Health Region Incident Command to adjust access to testing. And there are really three reasons we're doing COVID-19 testing: to diagnose people who have symptoms so that they can access the care and advice that they need, to perform contact tracing and investigate outbreaks, to limit the spread of the virus throughout the community, and to ensure that anyone who's been exposed to COVID-19 is aware of the risks and the options to protect others, and to proactively identify cases among high-risk populations, such as in long-term care homes and other congregate settings. So in terms of community, and there are 2 mobile services that are available by referral. So as the capacity for testing continues to grow, the Regional Testing Strategy Working Group is developing its recommendations and funding proposals to be able to move ahead in a way that increases community access to testing and uses the capacity in the most effective way, taking into account we still have to balance the testing capacity we have with the demand. So we do hope to be able to announce more or different testing options in the near future. As board members are aware, in March, Ottawa Public Health completed the first wave of a population level survey looking at perceptions and practices in Ottawa during the COVID-19 response. And we recently completed a second wave of questions for the public about mask use, hand hygiene, and physical distancing practices. So by self-report, which sometimes can be a little rosier than the reality. 60% of Ottawans report wearing masks indoors, 79% washing their hands before eating, and over 90% maintain a distance of 2 meters from others when indoors, almost always or always. These measures will prevent transmission of COVID-19 in our community, and they continue to be important to grow. By learning more about how Ottawa residents are managing through this time, we're better equipped to work with the community to provide supports where needed. So lastly, as Ottawa is gradually reopening workplaces and services, we have launched a new campaign called COVID Wise. The COVID Wise campaign aims to encourage residents to take their health into their own hands by understanding their own risks, the levels of risk associated with various types of activities and environments, and make informed decisions about their health and COVID-19. So Ottawa Public Health is promoting this website on social media using the hashtag COVID Wise. I am asking residents to go about their daily activities in a smart way to keep COVID-19 pinned down. And it is important to continue to realize that COVID-19 is in our community. We don't know where all the infections are. People don't always know that they are infected and infectious because they may not have symptoms that are significant, or they may be in the early days before they develop symptoms. So by following the COVID Wise campaign, residents can learn what actions they can take that could lead to less transmission of the virus, what might be a safer option. For example, we know indoor spaces pose a higher risk than outdoors, and larger gatherings of people and greater numbers of contacts pose a higher risk. And older adults and those who are immunocompromised are also at a higher risk of severe outcomes if infected. So I just want to take this opportunity in closing to thank Michael Allen and his team at United Way East Ontario. When we approached them recently for assistance in getting cloth masks to populations who may have barriers to accessing them, we found that the United Way East Ontario responded in a huge way. I couldn't be more pleased with their Facing Forward campaign. I encourage you to check that out online. Their incredible partnership, and especially with the leadership of Denise Taylor-Gillen and Jessica Smith, who worked with Ottawa Public Health to quantify the need, consider options, formulate a strategy, and then ensure coordination with other partners. So they've been our main points of contact, but we know several other members of the United Way team were involved to make something of this magnitude happen. I want to thank all of them for making this important initiative for anybody to have access to a mask, regardless of the barriers of income or isolation. It is something that is wonderful to see. So lastly, thank you to the board members, to the media, and all of you for doing your part to stay informed and promote the health of our community. Merci, miigwech, kanamik. Thank you. Happy to take questions, Chair.
Someone's got to do it, and I was on mute. So now it's been done for the meeting. Yeah, I want to echo your thanks for the United Way. They've done an excellent job. They seem to always do. I saw that personally as the counselor or one of the counselors impacted by the tornado, how quickly they stepped in and got organized and got assistance out to the community, and they're showing us that they can do that again in a very significant way. So thank you to the whole team at the United Way. So again, I'm going to go through the list, and if anybody has any questions, just indicate so, and if not, we'll just move ahead. Member Banham.
I just want to say thank you to all of the Ottawa Public Health staff. You've been doing such an amazing job, and the dashboard has been such a great tool that was rolled out. It's wonderful to see that, and it's so clear when you're staying on top of numbers and looking from city to city. I have to say Ottawa's numbers are very clear, and I know a lot of work goes into making that work and coming up with it and making sure that it's digestible for the public. So I want to say thanks to all the staff for what they're doing, and keep up the good work.
Thank you. Member Cloutier.
Merci, Monsieur le Président. Thank you, Dr. Etches. Let me just start by saying that your leadership, the medical professionals and communication professionals have been outstanding since March. You've all provided us with valuable information and practical guidelines, clear messaging, and calm, reassuring professionalism at a time of the upheaval of the pandemic. And we see a further example of the leadership in Ottawa with respect to OC Transpo that followed many of your recommendations. So just as a start, as a resident of the city of Ottawa, as a councillor, I am immensely grateful that to you and your colleagues at Ottawa Public Health. Have a couple of questions with respect to three items: contact tracing, Lyme disease, and testing capacity. Could you tell us a little bit more about the contact tracing app? It's going to roll out in July. Who is leading that? Is it the federal government, the provincial government? Could you give us a little bit more on that?
So it is the province of Ontario that has decided about a solution for the whole province of Ontario regarding an app that can be used to notify contacts if somebody is positive for COVID-19 and help with the follow-up of contacts. We are still learning more about it ourselves internally. And so I don't have much more to add. Andrew Hendricks is also, as our incident command, I think, available to answer questions if there's more detail he has, but I don't think we do have the detail yet. I know the federal government is also interested in promoting this kind of tool. And so I think there's collaboration between the different levels of government about how to use a similar platform that could be, relevant across the whole country.
Okay, so we'll learn more about it. With respect to Lyme disease and ticks, we had access to the tick tool last year, and it was very popular. The prevalence of ticks is no different this year than last year. Will we be getting some of those councillors have a little bit of access to those to those tools again this year for distribution to our residents?
Yes, I'll take that away, Councillor, to see how our supply is of tick keys. And for anybody who might be listening who wonders about how to remove a tick, you can check our website. You can also use tweezers. You just need to make sure you get the head of the tick and not leave that piece attached. So.
Okay, thank you. And the last question is with respect to testing. In other parts of the world that are a little bit more advanced on the COVID curve than we are, and maybe have seen a downturn, testing, I think, has been shown to be an important part of the solution. Physical distancing and masks also being important parts of the solution. Are we testing at capacity here in Ottawa at this time?
Yes, I'm pleased to say that we are making good use of our testing capacity now. It's been a bit of a dance, in the early days we didn't have very much testing capacity, no labs at all in our area doing the test. I had a chance to tour the Eastern Ontario Regional Laboratory Association recently at the CHEO and the Ottawa Hospital General Campus sites, and I can tell you it's impressive what they've done in terms of how much work it takes to calibrate a new machine, validate all the processes. Usually it would take months and months, and they've got things up and running in weeks. So we had wait times, unfortunately at some points across the province before there was as much capacity. And then we had dips down in demand for testing because it was focused on priority groups like healthcare workers, and before we were able to move up to opening it up to the whole population. So I think right now we're fairly balanced in terms of the population that's showing up for testing at the assessment centers, and the volume that we're doing is at the lab capacity. It's still a dance because we have a lot of other ways we could use the testing capacity if it was there. The surveillance in long-term care homes that the province has asked long-term care homes do 2 more rounds of testing of staff in June. That will take some capacity. The hospitals need some capacity for their operations. There's a variety of demands. So this is part of why I don't have a perfect announcement for you today about a new regional testing strategy, because there are many variables to build in. Clearly, from a public health perspective, we need to be able to test for contacts of cases and in outbreak settings. And then there's other kinds of targeted testing that may be warranted, in a workplace, in a residence. There's different situations. So we're learning about the testing that's being done in different scenarios. And I'm pretty sure what we want to do is reorient the testing somewhat to be able to test where we're most likely to find cases. Because what's happening right now with many people coming to the assessment centers is we're not finding very many cases. And we think that's good. That means, that people without symptoms are not as at high risk in our community, but we need to still find the cases that are out there. And so this is part of the adaptation in the response, is to look at new ways to be more agile and move away from 3 fixed sites, potentially. So there's a few things going on. We're working with our healthcare partners. Dr. Brent Malachny is our lead for the testing strategy within OPH.
Okay, and that's the question, and it's without an answer at this time, and I understand that. What will be the future targets in terms of employers that might be at risk? And I'm thinking of an Amazon environment or a call center environment or a transit employee environment. Would we, at a future date, focus on those segments of the population where there might be a little bit more exposure to viruses? So I understand that is still a work in progress. I appreciate your answer. Thank you very much, Dr. Etches. Thank you, Chair.
Yeah, and I will just add, because you mentioned some types of workplaces, the principle is that you're at higher risk of if you're in close contact with others indoors, right? So you can't maintain physical distancing, whether in your workplace environment or your housing environment. These are the venues that increase the risk of transmission.
Thank you very much, Vice Chair.
Thank you, Chair, and thank you, Dr. Etches. I'd like to echo what everyone else said about the incredible work of OPH staff. I think I speak on behalf of all the board members. We're all very proud. It always impressed me when, especially early on, when the information was changing all the time, and yet how clear as possible the communication was coming out of OPH. And I think that's really a really trusted resource. Not that it wasn't before, but really now really well established. So that's fantastic. My question is actually around vaccinations. We heard early on is that we were worried about vaccinations getting out, knowing that the schools are closed and those vaccination programs can't happen as they normally would. Member Banham did a great job of being a role model for many young moms and getting their vaccines, but just wondered where we are now with the vaccination rates and our plans for ramping that up.
Thank you. Immunization and the immunization program is at the top of our list when it comes to programs we want to restart. We have worked with CHEO to provide some immunization access for childhood immunizations where the family doctor's offices were not able to provide that service. But we know many family physicians' offices are open, and we encourage people to continue to go forward for immunizations of little ones. I'm sort of smiling at Member Banham over there, the 2-month immunizations coming up. So I could invite Marie-Claude to say more. Marie-Claude, if you would like to join in, she is leading our immunization team's work, and just not sure how easy it is to unmute. Marie-Claude Turcotte is the manager of the immunization team. She's also doing a lot of COVID-19 work. So please go ahead and speak up if you're online. Just interrupt me, otherwise I'll keep talking.
I'm here, Vera. Sorry, it took a
perfect.
while to reconnect. So yes, we are. We did, as you mentioned, a clinic with CHIO to provide immunization to children under 2 years of age who were not able to access immunization. And we are starting to look at catch-up clinics for the summer for teenagers who were in the schools and who missed their second dose, as well as anybody who needs a vaccine who were not able to get it. So we are looking at vaccination clinics over the summer and into the fall.
And I think the thing is we need to do things a little bit differently. So sometimes we would have a mass immunization clinic kind of scenario where there'd be lots of people all together trying to get vaccines. And so, probably the more scheduling we can do, the better, the more spacing out of access, the better. So as we resume our services, one of the core principles we're following is safety of clients and employees. And that does mean we're re-looking at how we offer immunization, although it's a priority to restart.
That's great. Thank you. And you actually mentioned the next question, which is the planning. So if when we do get a vaccine, presumably OPH will play a huge role in that. And just wondering if there's any planning happening around that mass immunization strategy, knowing that it's a bit out, but we will need to do things differently than perhaps we have for vaccines in the past.
Yes, so it is on our mind. We would love to have a vaccine, and the challenge of getting our whole population vaccinated, that would be great. And we have been through, mass immunization campaigns previously for meningitis in our community and for H1N1. The learnings from H1N1 will be very relevant because we had a vaccine that was in scarce supply compared to the demand. We had to do prioritization of different populations. That made it very challenging, right? So we'll learn from that. And we will, again, want to try to run clinics or an immunization process that avoids a lot of congregation of individuals. We have pharmacies that do immunization a lot more than previously. And I think we're going to be, we're sort of at the idea generation phase in terms of adapting, into different options for immunization. But I know this is also being discussed at the provincial level, and we'll be looking to coordinate with many healthcare partners, I'm assuming.
That's great. Thank you.
Thank you very much. Member El Chantiri.
Thank you, Mr. Chair. And can you hear me, Keith?
Yes.
Yes, we hear you just fine, Eli.
Thank
Can't see you, but we can hear you.
Okay, thank you. Dr. So we saw phase 2, from a business perspective, to my knowledge, went very good this weekend. We saw quite a bit of activities. When we'll find out if that has increased the cases, or like how long would it take for you to advise us if the opening was done well? What precaution we have to take more? I'm just wondering, when would be the time?
I'll tell you what I know, which is that usually after people are exposed to the virus unknowingly, then most people get symptoms within 4 or 5 days. Can be longer, can be up to 14 days later. Most people will not have severe symptoms, so they won't always go get tested, but we're encouraging people, if you have any symptoms these days, it could be COVID, to get tested. That helps us stop transmission in the communities. And so then once people get symptoms, it usually takes them 2 to 3 days to show up at a testing center. Takes another day for the results to come back from the lab and for us to phone cases and follow up with contacts. So that right there is about a week delay, right, in terms of from the time someone's exposed until when we might hear that or see that there's a positive and an infection confirmed by lab. That is probably the earliest we would see something from the time of exposure. Now, so we watch our test numbers. We look at our cases per day. That again, it's not a perfect measure. So there's no one indicator that I'm following that will tell me we need to, take a look at how much physical distancing we're doing and increase that physical distancing a bit more. It's the hospitalizations that I find are the most robust indicator of actual level of infection or community, because they don't really depend on somebody with mild symptoms thinking it's COVID or going to get tested. Someone sick enough to be hospitalized, that's going to show up. So that takes a little bit longer because usually when people are infected, then it takes a little bit longer to get serious symptoms. So that might be a 10-day delay, maybe more. So it's going to take some weeks, basically. I know, let's be realistic, it'll probably take 2 or 3 weeks before we could see something happening from the reopening on Friday. Now, for me, it's very important to keep employment opportunities available and people working. And so I think what we're aiming for is a balance. Cases start to go up, we'll let people know for sure. And I wasn't joking about physical distancing. Like, that's the key here. If we can go about our work and our gatherings with physical distancing, that should help us keep this infection to a manageable level. So that's the kind of thing that I would be raising. I hope that answers your question.
Well, thank you very much. Yes, it does. And obviously we need to keep an eye on, but your messaging to the community, it seems, is well received. So I'm happy, when we visit some of the local businesses as the co-chair of the Economic Recovery Task Force, we saw a lot of them follow your direction. They provide the sanitation, how to go to literally how to go to the bathroom and how to get out in a different direction. So what's ever available. So it seems the messaging is there. And also the community itself, they're taking, I think, their own precaution on. So I'm just afraid if we keep on too much messaging, so they don't feel safe enough to come out and because I didn't see a flock of people coming out on a weekend as we thought it is going to be honest with you. I didn't see that. I didn't feel that. So I'm not sure when would we be encouraging people to come out and take all the steps you have mentioned before, and also the businesses doing it in return. So is it going to be a point when you feel comfortable to ask people? Because it seems some people, they're holding back, oh, I don't want to be the first to go, or we should wait a little longer. I'm not sure, but I feel the business does need our support, no doubt about it.
Yes, so for higher risk populations, people over 70, over 65 who are more likely to have a severe infection, I do recommend caution and going a little bit more slowly. So take a little bit longer, a couple more weeks to see how the level of infection or community is maintained. I don't know how much, I don't want to take too long, but I think the idea is we need to balance here and to learn the principles that will make a difference to keep the infection transmission under control. And so the principles being, if all of us can limit our contacts as much as possible, that will help. Now, this is in a time of great joy about being able to expand our social circles, right? So the province is talking about social circles being able to go up to 10. And there's been confusion about that because it's new. There's lots of new changes, lots of messaging at the same time. So if you don't mind, I'll just pause on that for a second, just to say around the expansion of our contacts, the social circles we're talking about are people who would have the kind of contact that you might see in a household. So indoors, within 2 meters, maybe hugging, that kind of thing. That close contact is higher risk for transmission. And so we do want people to keep that the same 10 people and not have one person who's part of another social circle somewhere else, because that means really it's like there's 2 circles together. It's like 20 contacts and then 30 if there's another one somewhere else. So this requires some repetition and some learning to be able to figure out how to establish who those 10 people will be and then take precautions. The idea of the gatherings of 10 is different. That could be people outside your household. And there, again, the more you can keep it to the same kinds of similar groups, the better. It just decreases your potential for contacts and transmission. But if they're not part of your household or your social circle, the idea is to continue to keep 2 meters distance. So gathering outdoors is safer, keeping the 2 meters distance. And then, lastly, I'll just say there have been some complaints received, I gather, I haven't got any directly, about people gathering outside of their household or meeting on patios with others. But it's very hard for us to judge as an outsider whether those people are within a social circle or if they're part of a group that should be maintaining 2 meters. So it's a bit challenging to make judgments. What I encourage us all to do is think about our own actions and what we have control over, limiting our contacts as much as possible.
Okay, well, thank you very much, Dr. Atch, and thank you, Mr. Chair.
Thank you, Eli. Member Gower, please.
Thank you, Mr. Chair. Thank you, Dr. Etches, for the update. I have no further questions at this time.
Okay, thank you. Member Kavanaugh. Member Kavanaugh?
Yeah, thank you. I had to be unmuted by the host. Thank you. Yeah, thank you again. I appreciate all the work that public health is doing. No doubt this would have been much higher if there wasn't the interventions from Ottawa Public Health and where we are here. I wonder what we're doing in terms of preparation for a possible second wave. And there's still talk of that, and we're having a breather with some of the restrictions being removed. But and I'm not trying to be a pessimist, but I just want to know what preparations Ottawa Public Health is doing in that instance.
Sure. I'm going to invite Mr. Andrew Hendricks to speak a bit more about the planning that's going on as part of our COVID-19 pandemic response. Andrew, if you can manage to come forward, great. And to say that we are planning. We do anticipate that cases will rise, and we want to be ready to tackle that.
Yep, just checking to see if people can hear me.
Yes.
Yep, great. So thanks, Vera, for including me, and thanks to everybody for your questions. Yeah, we're definitely not slowing down, I would say, from a COVID response perspective. We're using the opportunity with less cases to reflect on what Wave 1 looked like, so that we can apply some learnings to Wave 2 activity. So during the first wave, we have a planning team that had put together different analysis based on what we were expecting cases to look like at the peak. And luckily, because of physical distancing and the use of masks and case and contact tracing, we never hit that original peak that some thought we would. But we're planning for worst case scenarios in terms of what that second wave could look like. And so we're busy training more people on how to do case and contact tracing. So that work is not stopping. We are just this week we are working with federal volunteers who can help support contact tracing efforts. We're looking at some of the outbreak management team work that we did with IPAC responses, and we're trying to reflect on what we learned during that time. Communications, a lot of the feedback we're getting from is around communications and how to communicate. How do we live with the virus? So the COVID-wise information is about how do we continue to live with this virus even through a wave 2. So it's multifaceted, but I can assure you that we're looking at all these different parts of the COVID response in order to make sure that we are being as prepared as possible for a wave 2.
I really appreciate that, and I have total confidence in that. One of the largest groups that was hit was residents in long-term care. What will be different in the second wave on that, in terms of how we react, knowing that this is the highest concentration of deaths and infections?
Yeah, I'll start and then maybe Vera, you can add. You know, the public health works very hard at prevention. We want to prevent cases in the long-term care homes and the retirement homes and other congregate settings. So, you know, testing is good to help find infections that are, especially if there's asymptomatic individuals in the long-term care homes. But we're really trying to enforce the preventative work. So the importance of universal masking in these facilities, the importance of screening employees, you know, before they come to work, all those types of things that that can keep the virus out of the long-term care home is where public health is trying to focus its efforts going forward. And then testing can supplement that work in a situation where there'd be outbreaks. We know that the provincial government has announced that there's going to be regular serial surveillance testing during the month of June. So testing these long-term care homes every 2 weeks. They've broadened that to retirement homes actually. So that will help ensure that that everybody who wants a test can be tested. But really, we're trying with our IPAC team, our infection prevention and control team, is to focus on those preventative efforts.
Okay, thank you very much.
And Counselor, I'll just add, you know, the hospitals have really made a difference in their intervention in the homes that were most stretched in terms of building the capacity of the staff that regularly work in the homes to deal with this kind of extraordinary situation, and to develop their own staffing plans so that the hospital staff may or may not be available to help again in the same way as they're busy, you know, starting up some of their hospital work. But the homes, you know, who needed some support to be able to recruit and retain people have had that, so they've been able to get back up to the level of staffing that is required.
I appreciate all the efforts that have been made because obviously that is a big concern. Thank you.
Member Lakin.
Thank you, Chair. Thank you to Dr. Retches and all the team for the extraordinary effort. I echo everyone's comments about that. Thanks for the opportunity to ask a question. I just wanted to follow up on the response to Member Kavanaugh's question about the second wave. I'm watching with concern what's going on in New York as compliance amongst residents is an issue. From what I gather, Ottawa's been particularly compliant with all the recommendations from OPH. Could Dr. Etches or staff respond a little bit to the issue of communication and trying to achieve the same level of compliance when we ask people to go from orange to yellow to green and back to yellow and perhaps orange? Could we just talk a little bit about what communication strategy might be considered to maintain this level of compliance with the second wave? Thank you.
Yeah, appreciate it. It's on our minds, and the first principle that I'm following, and I believe, you know, the team also is very interested in, is maintaining transparency and an informed public, so that people do understand if all of our behavior, it's all of our behavior that adds up, is getting us into a place of concern. And then I want to recognize that people have done the right thing so far. When there was concern that we would have overwhelmed hospitals, lots of death, people did the right thing. And so it's painting the picture that this is still possible, that we would get into that kind of scenario. And it's not just that you know, we wouldn't have a healthcare system to treat COVID. It's that we wouldn't have a healthcare system to treat car crashes or heart attacks or strokes. You know, it affects a lot of us if we don't have that kind of system. And people who have lost loved ones so far, you know, they can tell you, we don't want to lose anybody else in our community to COVID-19 if possible. So, and keeping in mind what's the rationale? Why are we trying to, you know, take on this difficult behavior of physical distancing, and why do we need to maintain it? The science around communications it suggests that people respond to encouragement. They respond to solid rationale and information, and aligning, towards something that is about doing the right thing and taking care of each other. And again, our polling tells us that the people in Ottawa want to do that. They want to care for each other. They do care. They are concerned about loved ones, especially who might be more vulnerable. And so we'll go back to these principles, keeping people informed, helping them understand with clarity what they need to do. This right now is a difficult time around clarity, I have to say. And so what's open, what's allowed, what's not, this is a messy time. But if we were to get into a dangerous territory of level of infection, I think that would be clear. We would be messaging very clearly what is required. So typically people who are informed with the right information understand will do the right thing.
Thank you so much. It's appreciated. And again, thank you for all your efforts.
Thank you. Member Menard, please.
Thanks very much, Chair. And thank you to all of OPH for all the work that you've been doing. I just have a few questions. With regard to the return of school in September, what do you think kids and families can expect in terms of guidelines? Are you seeing more susceptibility in kids? I've read different things on it, that they're not as susceptible, that they are, or that they get this exact same kind of cases, but obviously may not present in them as much as other folks. And so I'm interested in that. And then I have a second question around the expectation of a timing for, you use the word dance. And so as we move through, what kind of timing we might be looking at for a second wave. And then just finally, it seems to me that just from what I've read, that we may not find a vaccine for this. There may not be an effective one, certainly not in the next 18 months, and that it could be longer or maybe never. So maybe that's too harsh to say that. I don't know, but I'm wondering your view on those things. So the return to school, the expectations on a timing of second wave, and then a vaccination.
Okay, I don't have all of the answers, but I can tell you when it comes to school, it's the province that is leading with the Ministry of Education. And right now they're working on how this will look and how it will be different. And that's with public health input at the provincial level. As well, we have the relationships on the ground here with school boards, and so we'd be working with school boards to implement the provincial guidance and add any supports that are needed here in Ottawa. The province of Quebec has done this. They've opened schools and just across the river, and so we've been in touch with the people across the river. And we understand they're doing the same kinds of things right now that we would expect in the fall in terms of screening to make sure that children and teachers and anyone entering the school environment are not ill. If they do present with symptoms of illness, that there's testing readily available and good records for follow-up and contact tracing, that they're limiting the number of contacts each person has so that they can not have to close down a whole school, but just do follow up within a small group or cohort. Sorry, I think there's some background noise here. Just gonna ask if you could help me. Thank you. Sorry, I'm at City Hall, but there's some cleaning going on. So the other thing about schools is spacing out the desks, limiting the intermixing of classes. So there are quite a few things that can be done to decrease the exposure in the school environment. It won't be perfect. I would imagine, we may well see cases within the school environment. And then this is where your other part of the question comes in. It is good news that typically we're not seeing the infection in children cause severe illness. Best science we have suggests that children do get infected at the same rates as their parents. but they don't develop symptoms severe enough to warrant going for testing or hospitalization. Definitely, we're not seeing that in our numbers here as well. And so the timing then of when might we see an increase in cases, we don't know. I'm hoping we can keep the increase to a manageable level over the coming months, right? Like, so we expect some rise in infections with all the opening that's going on and all the increased social interaction. I expect a rise in cases, but can we keep that then to a manageable level over the next few months? I hope so. Into the fall, people talk about, well, you could get another rise. It could happen anytime that we get that rise if our actions aren't cautious enough. The challenge with the fall is we're worried about influenza, absolutely, and the two of them overlapping. So that's kind of the worst case scenario, where a lot of demand for management of respiratory illness. We'll be back talking more about influenza soon. And so when it comes to the vaccine, again, brings to mind influenza vaccine. We'll be promoting that shortly. We'll get everyone immunized that we can. You're right. It is possible that we will never find a vaccine, and we need to figure out how to live with this virus at manageable levels. But there is a massive effort globally. I think there's over 120 different vaccines, I gather, that are being studied right now. And, this is probably overused word in this pandemic, but unprecedented level of collaboration and scientific effort to create a vaccine. So I'm hopeful, but we can't rely on it at this point. And it probably would be, still quite likely 12 months out.
Okay. Thanks very much, Chair.
Thank you. Member Pinel.
Docteur Etches, je n'ai pas de question, mais je veux ajouter mon merci et ma reconnaissance pour tout le travail accompli. Merci.
Merci.
And finally, Member Tilley.
Well, just first off, Dr. Etches, thanks to you and the team at Ottawa Public Health. We had our first incident here about 3 weeks ago, as you are probably aware, and I just think it wasn't so much the contact tracing and how fast we were quick to track down people and isolate and get everyone tested. And again, that was a staff member, part-time, who had actually been in contact with patients in the hospice of all places, our biggest worry, our hotspot here at the shelter. But I think it was more for months now, the preparedness, the training, the utilization of PPE, because the fact that that individual did everything they were supposed to do that day on their patient visits is what I believe is responsible for it ending there and not having turned out worse. So thanks in advance for those months of training with yourselves, with Inner City Health, that we were prepared. And that individual on that day did everything right as far as doffing and donning and everything else between patient visits. So what could have been a bad story, a terrible story, was in fact somebody who's recovered and doing well. And secondly, just a question, I met with our director of health,
And we hope, the summer's great time, the weather's better, to take vacation now. So we're promoting that. But you're absolutely right. People have been working really hard, a lot of overtime. A lot of, unfortunately for a period there, we had to suspend things like compressed work weeks or other ways that we would usually provide more flexibility in staffing hours. So we're going back and looking at what can be resumed to make the response more sustainable. And yeah, I'm checking in with the team tomorrow, so we'll hear the team's perspective on where we're at now. But the idea is that we do need to be taking those breaks.
Good to hear.
So I'm going to ask, as it's now 6:49 and we have a motion that will flow from this report, and then we have another matter that's held. If I could get Member Pinel to move the motion to extend our meeting time past 7 o'clock, just in case.
Absolutely, Chair. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
I know people probably would not like to carry this, but carried. Any dissents? Okay, thank you very much. I'm now going to ask the Vice Chair to take my role for a few minutes, as I'd like to introduce a motion arising from Dr. Etch's report. So I'm going to cede the chair to the Vice Chair, and I'll introduce the motion then.
Thank you. So I will call on Chair Eglai to introduce the next motion.
So I'm going to read this motion in its entirety, because I think it's important, not only in terms of how we're carrying out this meeting, and I want people to know what we're voting on, but the subject matter also is very important, and want everybody to be on the same page as we enter into discussions about it. So, whereas racism, discrimination, and stigma are associated with poorer physical, mental, and emotional health and greater mortality, making anti-Black racism, anti-Indigenous racism, and racism against minorities an important public health issue. And whereas public health has a role in promoting the health of the entire population by working with others to ensure fair opportunities for health and well-being, and whereas Ottawa Public Health is guided by its commitments to engage, as expressed in its 2019-2022 strategic plan, to work with residents, partners, and communities to develop the conditions that support health and health equity. And whereas members of the African, Caribbean, and Black community experience physical, social, mental, and emotional harms to health due to anti-Black racism present across sectors, including health, education, employment, housing, childcare, policing and law enforcement, and the criminal justice system. And whereas the mental health impacts of racial discrimination will be highlighted in Ottawa Public Health's Mental Health of Ottawa's Black Community research study, which is set to be released soon and will include recommendations developed with the community. And whereas Ottawa Public Health's 2019-2022 strategic plan also expresses the health unit's commitment to reconciliation, working in partnership with First Nation, Inuit, and Métis peoples and communities to advance Indigenous health equity. And whereas First Nations, Inuit, and Métis community members must have control over how data is collected, analyzed, and used related to the health of Indigenous community members, including COVID-19 data. And whereas Ottawa Public Health is exploring opportunities to collaborate with the city's anti-racism directorate, with Councillor King as the city's liaison for anti-racism and ethno-cultural relations initiatives to address anti-Black racism and the impact of racism on First Nations, Inuit, and Métis people, newcomers, and others. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit recognize that racism is a public health issue and direct the Medical Officer of Health to establish training targets for board members, employees, learners, and volunteers to participate in anti-Black racism and other anti-racism training to contribute to improved health outcomes. And be it further resolved that the Board of Health direct the Medical Officer of Health to develop an evidence-based campaign to increase awareness of the impacts of racism and discrimination related to COVID and actions to counter racism in Ottawa. And be it further resolved that the Board of Health dedicate resources and direct the Medical Officer of Health to seek further community partnerships to implement recommendations to improve African, Caribbean, and Black mental health in Ottawa. And be it further resolved that the Board of Health establish a process in collaboration with First Nations, Inuit, and Métis partners to ensure respectful planning, collection, analysis, and sharing of health data to inform improvements to physical and mental health of Indigenous populations in Ottawa. And be it further resolved that the Board of Health direct the Medical Officer of Health to ensure that Ottawa Public Health informs community consultations on addressing systemic racism in Ottawa, such as through the community safety and well-being plans development and implementation. I just wanted to say a few comments about this motion. and how it came to be. These are difficult and challenging times, and OPH is actively engaged in many of these current issues of concern and importance. In this regard, I reached out to Dr. Etches over the last few weeks, and we've engaged in a dialogue about the public health ramifications of racism. I want to thank her for the discussion and the concern that she expressed for this issue and the time she made so we could have a fulsome conversation on this very important topic. I also want to thank my colleague Ralston King for a number of discussions over the last few weeks in relation to the new role he has graciously accepted on behalf of Council and how we can work together with the Directorate and Councillor King in his role going forward. As a result of these discussions, Dr. Etches and I decided to craft a motion on public health and the impacts of racism to allow for further dialogue at the board level. We embarked on a drafting process with the able assistance of our board secretary, Deanne Blais. This process took some time, but we wanted to do our best to capture OPH's role and ongoing part to play in responding to racism in our community. This is a difficult, emotional, and vitally important discussion that we have. We wanted the motion to speak to the work that OPH has been doing already, as well as the direction forward. We both wanted the motion to not only say something, but to do something, because no matter the role OPH has played so far, that role can and should be modified, enhanced, and strengthened. The problem we are addressing is not a static one, so a response needs to respond to that dynamic. I believe we have achieved that balance with this motion. So again, I want to thank Dr. Etches and her whole team for their assistance and support in crafting this statement of our path forward, a path that we will likely have to revisit again and will as necessary, but I believe this is a solid start. I also want to thank all the board members that have reached out to talk to me about this motion and to Dr. Etches and provide input, such as Councillor Menard and Councillor El Shantiri. Your input and support is greatly appreciated. Dr. Etches and I are happy to take questions about this motion. I would urge all of you to support this motion as a step forward in OPH's engagement with racism as a public health issue of significant concern to our community. And I'll turn it back, well, I'm not turning it back over, I'll just, it's over to the chair.
Thank you, Chair. So I think your intentions are grounded and the dynamic nature. You know, I think this motion speaks to that it is a first step and it is action oriented, and I fully support how it's crafted. I have no further questions. I will call on the members for questions or comments, starting with Member Bannum.
Hi, so first I'd like to say that I will be supporting this motion. I think it's a good motion and I think it's timely. So thank you to everyone involved in crafting this motion. I do think we need to look at it with the privilege that we have. And in looking at it with the privilege that we have as a board, as board members, and myself as a white woman with settler parents, I do have to say, one question I had was why there wasn't an inclusion about looking into leadership and staff and promoting a more diverse leadership and staff. I believe I remember from a previous conversation on the board that some work has been done. And I know that this talks a lot about partnerships, but partnerships are, you know, outside relationships. And I think for things to change, you really need leadership on the inside of the organization and you need those views represented. So I just was wondering if that was considered or if there is consideration moving forward. And if you could speak to that, thank you.
So I'll speak to that. Thank you. Absolutely, we need more perspective on the work all the time, and so I think the intent is to continue to work towards targets to improve the diversity and leadership within Ottawa Public Health. We're supported by the City of Ottawa in that process, and so this is work that we're doing with the Human Resources Department with the City of Ottawa to look at hiring practices and employee support. The the work that Councillor King will lead, that Chair Eglai referenced, it is definitely going to be focused on some of these areas. And so I'm sure we have more to learn and more we can do around the governance of Ottawa Public Health at the board level. That is a process where the recruitment happens as city council changes, and the board members also can change at that time. And so looking again at how we recruit board members will be very important. Maybe just to say why was it not in this motion? Not intentionally left out, work we want to look at. This motion focuses on things that the community, the African Caribbean Black community have told us they want us to work on around mental health and the actions that they want to see advanced coming out of the work on mental health, and the recommendations that are being developed with the community, as well as the report that you saw this evening on reconciliation. And again, the community directly asking us to make sure that we're advancing the respectful and appropriate way of looking at data and using data related to First Nations, Inuit, Métis health. So that was that the actions were drawn on community, based out of community input on priorities.
Thank you.
Thank you. Membre Cloutier?
Merci. I will be supporting the motion, but I have no questions, and I thank the chair and Dr. Etches for bringing this forward today. Thank you.
Thank you. Member El Shantiri? Member El Shantiri? Okay, maybe we'll hold and we'll come back. Member Gower?
Thank you, Chair Eglai, for introducing this motion, and I will be supporting it, but I have no further questions at this time.
Thank you. Member Kavanagh?
Thank you very much. Yes, I'll be supporting it, and I want to thank Member Benham for her excellent questions, because that is very important that we start from within. So thank you. Lots of work to do.
Thank you. Member Lakin?
I'm here. Thank you. I fully support the motion. I want to commend leadership for bringing it forth. I think any public health initiative to combat racism as a target is worthy. I also want to just underscore that it also impacts health inequity, and to the extent that targets or interventions aimed at reducing racism and targeting it will in turn improve health equity. So fully support it.
Thank you. Member Menard?
Thank you very much, Madam Chair. And yes, thank you very much for bringing this motion forward. It was great to work with you on it, and input that was well received by you. So thank you so much for that. I just have really one question, and it's around how OPH will capture race and socio-demographic data to measure the current state, impact, and progress in addressing the health inequities in our city. So how is that data going to help to inform future health policy and public health planning outcomes, in terms, just to get into some more specifics?
This is where I'm wondering if Amira Ali, our senior epidemiologist, is online. But I can tell you, before COVID, we had already implemented a process to collect social determinants of health data for people that were coming to our clinics, like the immunization clinic and the sexual health clinic. What was lacking in the COVID response is that those kind of variables were not built into some of the provincial databases that we use. This is shifting. It's very good news. And as the province moves to introduce new case and contact management tools and build in the capacity to look at ethnicity, that will improve some of the data. But what we're also hearing from our community is that the numbers aren't enough to get a picture and build understanding of the inequities in the community. And so what we're doing through the COVID response is talking to people, trying to collect more of the qualitative information of the experience people have. And the same with the African, Caribbean, Black community around mental health. There's stories that need to be heard, and as well as the numbers. I'm optimistic that we will improve the whole healthcare system's ability to collect data on race. The community health centers have been collecting social determinants of health data for a long time, but hospitals have not been able to implement that kind of process outside of the Central Toronto LIN process that was previously led there. So we are looking for that kind of system transformation where race and income would be routinely collected as part of delivery of healthcare to see who is being served and how they're being served. So there's many other things that we can look at across different sectors. Just to give you an example, the Ottawa Child and Youth Initiative is one where we work with school boards, we work with police, we work with social services, we work with many nonprofit organizations, and collectively people are interested in promoting equity among common outcomes. And so again, I think across sectors we're starting to see that people know if we're going to measure progress, we need to have the right way of measuring. And so it's not just about the outcomes, it's about being able to look at, as Member Lakin said, the inequities in outcomes, because the average score, the average measure can really hide a lot of inequity. I hope that addresses your question.
Yes, thank you very much.
Thank you. Membre Pinel.
Thanks to all those who worked on this motion. I think it was much needed and I completely approve it.
Thank you. Member Tilley.
Great initiative. Happy to support it.
And I'll loop back to Member El-Shantiri. Member El-Shantiri. Okay, we will go to Chair Eglai.
I did it again. I was on mute. It doesn't sound like the board needs much convincing on this issue, and I can tell you that makes me quite pleased, and I'm sure Dr. Etches shares that. When we started this discussion and started putting pen to paper, we felt that we had a like-minded board. We just had to find the right wording and the right intent, but we felt that we had a like-minded board that would absolutely be supportive of this going forward. And you haven't disappointed us in any way, so thank you very much for that. And that's all I have to say on it.
Thank you. So we will take the vote to carry the motion. Yes?
Carried.
Any dissents?
Carried.
Excellent. Thank you. And over to you, Chair Eglai.
Thank you very much. The board will now vote to receive the medical officer's health verbal report as amended by the motion. Received? No dissents? Thank you. So the I can go back. I believe that it was Member Kluche that held an item for questions. And
item 6, Chair.
Item 6, that's correct. And so we'll move to that. Do we have Lou on the line for questions? It appears we do. Okay, so Member Kluche.
Thank you, Chair, and thank you, Lou, for being there. And I understand that there's an amending motion. Is there not, Mr. Chair, on that item?
There is a motion. Would you like us to introduce the motion before you ask your question?
As you see fit.
Well, why don't we? And then everything will be on the table. So if I could ask Member Pinnell to introduce the motion.
Absolutely, Chair. Whereas Ottawa Public Health has been in enhanced operation since January 28, 2020, due to COVID-19, which was declared a global pandemic on March 11, 2020. And whereas since even prior to that date, Ottawa Public Health has been working closely with various health sector partners, neighboring health units, as well as multi-jurisdictional all hazards emergency preparedness partners, including first responders and the Ottawa Airport Authority, to assess the local situation, review guidance and recommendations from other jurisdictions, share information and coordinate actions to mitigate the impact of the pandemic. And whereas the province of Ontario has been and continues to be in a provincial state of emergency since March 17, 2020, while the City of Ottawa has been and continued to be in a municipal state of emergency since March 25th, 2020. And whereas on March 25th, 2020, the Government of Ontario announced an increased investment of up to $160 million for the public health sector for COVID-19 extraordinary costs, $100 million of which was specifically approved for extraordinary costs incurred by public health units and Public Health Ontario in monitoring, containing, and detecting COVID-19. And whereas on April 23rd, 2020, Ontario's Chief Medical Officer of Health issued an memo to boards of health, public health units regarding COVID-19 extraordinary costs, in which he reiterated that public health units are expected to take all necessary measures to respond to COVID-19 while continuing to maintain critical public health programs, provided assurance that there will be a process for reimbursement of COVID-19 extraordinary costs, and requested that public health units continue to track COVID-19 costs separately. And whereas local health units have yet to receive confirmation from the Government of Ontario with respect to their 2020 funding, and these health units are currently operating with great financial uncertainty since there is no information on what portion of the announced funding will be provided to each unit. And whereas as of March 31st, 2020, Ottawa Public Health is operating with a budget deficit of $280,000, and current budget deficit projections could increase to between $5 to $10 million, depending on future COVID-19 response requirements. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit direct its chair to write to the Premier of Ontario and the Ontario Minister of Health to ask that they commit to providing 2020 funding letters as soon as possible, including details of processes for local health units to draw on one-time funds allocated to extraordinary COVID-19 costs, providing a commitment to increase local health unit-based funding in 2021 to address ongoing COVID-19 operating requirements, including ongoing increased pressures for evolving public communications, informing and guiding numerous stakeholders, supporting the testing strategy, maintaining new surveillance and reporting requirements, carrying out case management and contact tracing, leading outbreak investigation and management, implementing new information technology systems, as well as preparing for mass immunization if a vaccine becomes available, and that they share this information with local health units before the end of Q3 in order for it to be included as part of the 2021 budget deliberations.
Thank you very much for doing that. And I'll turn it back to Member Cloutier for his questions.
Thank you,
And
Chair.
then we'll go through the list if anybody else has any questions.
Thank you, Chair. I thought it was important to get that motion out because it deals specifically with the question that I would have had. And I saw it in the procedure memo after I'd read the report that on March 25th, the provincial government had announced $160 million. I guess my question to perhaps Mr. Flaboria or Dr. Etches or anyone else, have the discussions surrounding extra costs borne by local health authorities, local public health authorities, have those discussions been going through our provincial network, Alpha, or have they been generally one-on-one with the individual public health authorities?
Yeah, go ahead, Lou. That's fine.
To date, we've had discussions with our provincial representatives. So myself, as well as my counterparts across the province, have had several discussions with the ministry about these funds coming forward. They initially indicated to us that they would let us know by before the beginning of summer. So we were hopefully expecting them already by now, but we haven't received anything to date. But they've given us general information, but it's general information doesn't give enough information specifically to each health unit in order to assess their current situation.
Noted. And I trust that you and your department are, I guess one of the requirements are tracking the costs, the additional costs that have been borne by OPH with respect to communication, intervention, and all the work that has been done as a response to the pandemic.
Yes, absolutely. We have a special cost center where we track all those costs because we're anticipating putting a package together for when the ministry outlines the process so that we could provide it back to the ministry. And it also gets audited. If not through this year, for sure, it'll get audited next year. So we're preparing ourselves for that as well.
Okay. Thank you very much. And one of my other questions, Vice Chair Di Giovanni spoke to it as part of Dr. Etche's report. I had it as part of the finance with respect to the expectations of the vaccines in the falls and the logistics and the costs. So we're looking forward to that. On document 1, Lou, the year-to-date budget is not 25% of the annual expenditures. Most are close to the 25. One of the large items is the chronic disease prevention and well-being, where we have spent less in January, February, March than 25%, which, what is the seasonality of that expenditure? Does it relate to the fall flu vaccine, or is there another seasonal component to those cost behaviors?
Various programs in that area. I know that one of the big ones why it's underspent is the seniors dental program that was just starting to get going. And so it was ramping up. And so the first quarter probably shows less than that 25% for that reason. It's a big component of that budget. And so we're pre-COVID, we were hoping to have that program ramping up and then the rest of those funds getting spent. So that would that's the main component of that one.
Is that's a primarily provincial funded program, is it not? Seniors dental health?
It's 100% provincial.
100% provincial. Great, thank you. That vaccines. The only other question that I had, a small one, on document 3, looks like we have made an adjustment to the electronic public health record project, $70,000. Not big, but could you remind me about that project and why? Could you tell me about that project and why those costs are not being spent on that project at this time? Is that entirely COVID related?
Actually, it's basically our reserve fund that we contribute to annually for our IT initiatives. And whenever we presented the budget in the fall, we hadn't closed out the year, so we proposed a budget of the current year, which was 2019. When we closed off 2019, we realized that there was less funds in that reserve fund, and so we adjusted the figures that was supposed to come into the 2020 budget down to reflect what we have in our reserve fund. So it's less money in the reserve fund means that we would have to lower our expenditures for 2020 in order to stay within our financial means.
The project is going forward, though, the electronic public health record project?
It was at the time pre-COVID. It's now been put on hold, and so at this point it's on hold. But prior to that, it was moving forward. Yes.
Okay. Okay. Those are my questions, Chair. Thank you.
Thank you very much. I'll just go to the regular list now. Member Banham? No. Okay. Thank you. We've dealt with Member Cloutier. Member El Chantiri?
Yes.
Member.
He's there. He's there.
Oh, he's there. Oh, sorry. Eli?
Yes.
Do you have any questions on the finance motion?
No, sir. Thank you.
Okay. Vice Chair?
No questions for me. Thank you.
Thank you. Member Gower?
No questions for me. Thank you, Chair.
Member Kavanaugh?
No, I'm fine. Thank you. My questions have been asked already. Thank you.
Thank you. Member Lakin?
All good for me. Thank you very much.
Thank you. Member Menard?
No questions.
Okay, thank you. Member Pinnell?
No questions.
Member Tilley?
Could I hear the motion again? Oh, just having some fun. No questions.
Thank you. Yes, I hope everybody will support this motion. The 2021 budget is going to be a challenging one. We don't know what the impact of COVID is going to be on this year, and even more so, we don't know what it may be into the following year. So this will help to get the province's attention, help us to get some answers that we need to have so we can better plan how we're going to go forward. So can we carry this motion? Thank you. Any dissents?
Carried.
Thank you. Can we receive the report as amended by the motion?
Received.
Thank you. No dissents? Okay, thank you. Can I ask Member Pinnell to move the motion to adopt reports, please?
Il est résolu que le rapport verbal du président du conseil de santé, le rapport verbal de la médecin-chef en santé publique et les rapports intitulés « Rapport annuel de 2019 de santé publique Ottawa, réconciliation, équité en matière de santé autochtone et COVID-19, plan stratégique de santé publique Ottawa pour 2019-2022, mise à jour du premier trimestre 2020, rapport d'étape sur le budget de fonctionnement 2020 du T1 du Conseil de santé pour la circonscription sanitaire de la ville d'Ottawa soit reçu et adopté.
Okay. Can we carry the procedural motion to adopt reports? No dissents? Thank you. Are there any motions requiring suspension of the rules of procedure? Okay, thank you. Are there any notices of motion for consideration at a subsequent meeting? Okay, thank you. Can I get you, Member Pennell, to move the motion to adopt the confirmation bylaw?
Be it resolved that confirmation bylaw number 2023, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of June 15, 2020 be read and passed.
Can we carry this motion? Carried. Okay, any dissents?
Carried.
Thank you. Are there any inquiries? Thank you. I want to quickly thank all of you. I think we did some important work here tonight. I think we did it in a very new forum for us. And aside from a few people not muting or unmuting, mostly me, the meeting went very smoothly, and I want to take the opportunity to thank our board secretary. She did the research to figure out how we could best carry out a virtual or a remote meeting. She had us all get together this morning, do a run through to make sure that we didn't make any mistakes. So I want to thank you for that, and also Ashley Brambles, who helped in determining the appropriate technology for us to use. As well as it went, though, I hope that soon we can meet all again in the same room, share a sandwich or something before the meeting, and see each other up close and personal. But thank you all for the work we did tonight. Much appreciated. Can we carry adjournment of the meeting?
Carried.
Carried. Thank you. I'm assuming there's no dissents. Our next meeting is scheduled for Monday, September the 21st, 2020 at 5 p.m. Before we close, I just want to remind any media who may be watching this meeting on the YouTube live stream that we will have a Zoom media availability 15 minutes after the adjournment. So it's now 7:26, so 15 minutes from now. This replaces the post-meeting media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. Thank you very much.
Happy summer.
Thank you.
Bye.